So we're here with Peter Wyllie, who's a generalist, rural generalist, GP anaesthetist. What do you?
I guess I prefer the term rural generalist,
Yep.
but yeah, because rural generalist is sort of encompasses all the different types of procedural GPs that do different things in rural and remote towns in Australia. But I guess my discipline is anaesthetics, and I was, traditionally known as a GP anaesthetist. But I prefer, the concept of rural generalism.
Rural generalist it is. Peter's he kicked off the second plenary session, which was, I think, to be fair, one of the most interesting and diverse plenaries I've ever seen at an ASM. It was surface of Mars, space flight, inside the depths of the brain. Peter obviously talking about his time in a few places. I think this is the first time anyone has probably ever seen you, with the speaker thrown off a cliff in the first sort of 30 seconds of the speech. But obviously that reflects your interest in some more diverse areas beyond anaesthesia. But I thought it was really interesting how you talked about how that pertains to anaesthesia. How did that come about? Did that come from you sort of applying those interests to rural generalist anaesthesia, or the opposite?
Yeah, so I think over time, as I started working as a doctor, I realised that I was gravitating towards these parts of medicine that really were using that sort of decision-making process and the mindset that I had acquired in these different parts of my life. And it took, I guess, doing some procedural work and working out in rural and remote places to appreciate that actually, when I was working, I was like, oh, I've actually come across this concept before, and the way I'm learning about anaesthetics in a remote place is actually familiar to me, and I've been sort of using these things in climbing and base jumping in my approach to these, I guess, potentially dangerous scenarios that you're trying to make a lot safer with your approach to them. Yeah. So yeah.
I guess something else that must obviously appeal to you beyond that is the amazing diversity in work you get to do. I mean, is that an appeal?
Absolutely. So working out in a place like Alice Springs, you get to do some GP work. For me personally, I get to do some GP work, some retrieval work, which is both flying shifts and working in the retrieval coordination centre. And of course some anaesthetics as well. I get to do a day a week working with the anaesthetic department in Alice Springs Hospital. Which is great because it's sort of a hybrid. We're working with specialist anaesthetists there, and there's a couple of GP anaesthetists too, so we have, there's great collegiality between all of us there. So yeah, I think I'm one of the luckiest doctors in the world really to get to do GP work, retrieval work and anaesthetics work, literally all within the space of a couple of weeks. I'll do all of those three jobs, so in a beautiful place. So Alice Springs is one of the most, people think it's just desert out there, but it's actually this beautiful mountain ranges. There's heaps going on. There's lots of outdoor activities. So it's a great place to live and work.
Yeah. Well, I mean, I don't know. Hopefully, you get a chance to talk to Rod Mitchell, because his background is fairly similar to yours, I think, early on. Yep. So he could be the president of the college someday. Yeah. And with that, because Rod's got a few sort of passions, and what sort of about the implications for sort of rural practice, anaesthetics or not. What do you think? You're a mountain climber. Yep. What are some of the mountains that you think need to be climbed in rural generalists, general practice, anaesthesia, medicine in the country?
Oh, that's a good question. Look, I think rural generalism is going to become more and more useful, and it's going to be recognised as being more and more useful in Australia, especially in these. In rural and remote towns where there's just not the availability of specialists from all the different medical specialties. I guess the mountains to be climbed, I guess, is just ongoing recognition and support for rural generalism. Actually outside of Australia, even rural generalism is taking off in different parts of the world. And my college, ACRM, is actually is starting to teach rural generalism in different parts of the world, like through the South Pacific. I think recognition is a big thing, and just ongoing support, I guess, for proceduralists out in rural and remote towns.
I guess something that's interesting and sort of burgeoning too is the use of technology in bridging those gaps as well. What sort of input do you have from that, or are you involved in that?
So absolutely. So Western Australia is really leading the way with telehealth, but I'd say the NT is not far behind. I'm actually a long way ahead of the southern states, I think, on this in using telehealth in the Medical Retrieval and Consultation Centre, which we've set up in Alice Springs. We probably do 40 or 50% of our telephone consults using telehealth. So, and a picture speaks 1,000 words. So using that technology, and the technology is all there. It just needs to be utilised, and the way it can improve patient outcomes by not only just managing patients on the spot in the emergency type situation, but being able to keep patients in communities and saving retrievals from happening. That's the big plus. You're actually being able to save money and save resources by managing people where the default used to be, let's just bring this patient into hospital. Now we can actually see what's going on, manage it on a daily basis, review it the next day with telehealth. So those sorts of things are invaluable, I think.
And so important for the Indigenous communities who maybe don't want to sort of travel huge distances for cultural and obviously logistic reasons.
Yeah, and coming to Alice Springs is a huge thing for someone living out in a remote community.
So you're in Malaysia. What have you got planned for the week? So at the conference and sort of maybe beyond the conference.
Well, there's a couple of buildings over there that might be perfect
to jump off in.
To jump off. No, actually, it's not a time for jumping. Although there are some events here every year, some base jumping events. Just enjoying the culture here, enjoying the good food. And Kuala Lumpur is a fantastic place to visit. So I'm really happy to be here.
Well, thank you for coming. Thank you for coming all this way, and
for
an excellent talk. We look forward to hearing from you for the next few days.
Great.
Enjoy Malaysia.
Okay, thanks very much.
Thanks very much.
Cheers.